Thank you very much. Good afternoon, members of the media, members of the viewing and listening public. Thank you for your attention. Today, I want to follow the normal protocols and invite the Minister of Health to invite his staff to give us the daily health briefing, which today I will commandeer a little bit more of the time because I want to talk to the population a little bit. So if the Minister of Health will accommodate by inviting Dr. Parasram to give us a highly anticipated daily update.
Hi, good afternoon, Honorable Prime Minister, Honorable Ministers, members of the viewing and listening public. So the status update as of today, 16th of the 4th, 2020. Total number of patients that would have tested positive to date, 114. Total number of tests submitted to CAUVA, 1,282. Total number of discharges thus far, 20. Total number of deaths, 8. Total number of hospitalized patients as a group, 63. The number of patients that are within the COURA health facility, 11. Those within the COUVA facility are now at 52. We have 0 patients in the ICU as of today. There's only 1 patient in the high dependency unit, which is in a stable condition at this point. The remaining 51 persons are all ambulatory and very stable. Within the Sangre Grande decanting convalescent facility, there are 23 persons to date. With regards to the testing, just to remind everyone in the public, just a couple of minutes to run through the testing in terms of positivity. So basically, CAUVA is the lab that, for now, in Trinidad and Tobago, that does the testing. They would have a positive patient going either to COURA or COUVA. Either of those facilities are, for now, the facilities that are designated for treating positive patients only. They are only treated within those facilities. In order to be discharged, you have to have 2 subsequent negatives 24 hours apart after your first negative test being done 15 days after the onset of symptoms. Just in way of discharge, thank you.
Doc,
yes?
Hold your position, please, Doc. We'll go slightly differently today because I want to address a couple of issues that are not entirely on COVID. So if the Minister has anything to add, now is the time to add it or introduce.
I could just update the country. I did receive the report from the chairman of the Eastern Regional Health Authority yesterday. The report has been sent to the legal department of the Ministry of Health. I have read the report, and I plan to ask for some additional information after the legal department has looked at it, and I will communicate that to the chairman of the ERHA in short time. Thank you.
If there are any questions specifically to the management of the COVID-19, I would like you to ask them now, and let's close this off, the health section, before I introduce other matters. So now is the question time for the COVID issues.
Roshan from Newsday.
Stephanie,
Dr. Parasram, can you just give an update in terms of the number of tests or samples that you've submitted to CAUVA? It seems to be that it's plateaued. I think
yesterday alone, we would have done 61 tests, just to give you a daily sort of average. If you look at the 5 days prior to that, our average would have been something like 52.25 over 4 or 5 days prior to that. For yesterday's 61 tests that was run at CAUVA, we had no positives in that group. So that's our sort of daily average over the past week or so, to give you an idea how many physical tests we're doing there.
Okay, so if you could just explain the updates, the way that the updates are, how, like, it says from the update 106, it was 1282, 107, 1282.
Yeah, so as I said, is number of samples submitted. So because we give you all our updates so frequently, we give it 3 times a day. Sometimes the sample collection is actually at the morning period, to the most part. Some samples do come in during the course of the day, but the updates will change on the numbers because we're doing it 3 times a day, a few hours apart. Sometimes we submit a bulk of samples in the morning period, and that remains stagnant during the day, and they run the tests during the course of that day. So you may not see these submitted increasing greatly over the course of one day.
I'm sorry, and if you could just clarify, I don't know if there's an average, but is it Can you give an idea of how many tests are accepted by CAUVA and how many are rejected?
The majority of tests are accepted by CAUVA. I would have maybe somewhere in the region of 50 thereabouts would have been rejected over the entire period so far, a little more than 50 maybe. And those would be for various reasons. Either the sample is not adequate. It can be because they don't meet the clinical case definition as defined by CAUVA that we went through before. So there's a number of reasons. There are other reasons why the sample would be rejected by CAUVA, but generally speaking, those are the main ones. Yeah.
Crystal Wilson, TTT. Two questions from members of the public. One, if a person tests positive for the COVID-19 virus and they do not have underlying health issues, can they safely self-quarantine at home? That's one.
Right.
Two, asthmatics, this is our season. How can they tell the difference in terms of whether or not they're having a regular attack as opposed to COVID?
Right. So the first question, the answer is no. Once you have a COVID positive patient at this point in our country, because we have minimal spread, we want to keep it that way. So for two reasons. We have enough treatment sites, both at COURA and COUVA at this point, and we are treating every single COVID positive patient within our institution. So they are coming to institutions. In other parts of the world, they have actually treated COVID positive patients with very mild symptoms at their home. Maybe as the numbers increase, we may move towards it later on in the epidemic. But right now, we have the capability and the capacity to treat them safely in the institutions from a medical perspective, as well as a perspective of isolating the patient so there's no further spread. In terms of differentiating asthma generally presents, persons with asthma don't present with a febrile illness. So they don't have fever to the most part unless you have an underlying infection. So asthma will be shortness of breath, and most asthmatics will know what their signs and symptoms are. They will have wheezing, they will have shortness of breath, they may have fatigue, they will have exercise intolerance. Those are the signs that you'll tend to have in asthmatic versus some sort of viral illness. So those are the main distinguishing features.
Media. I have some questions more on, not specifically to the medical aspect of COVID-19, but more with the entire so now, okay. All right, Minister Deyalsingh. So April 30th has been the new date for the deadline for the stay-at-home measures. How are we looking right now? Is it too early to say if we could see that being the final date, or it'll have to be pushed further?
Okay. Let us be very careful. I mentioned yesterday, let us not raise the victory flag too early. Let me just remind you, when the Spanish flu was hitting certain parts of the United States, one state raised the victory flag very early, and they went out on the streets and celebrated. And what happened? A second wave. So let's wait until the April the 30th. Do not raise the victory flag too early. It is way too early to do that.
Okay, so with that aside, whenever we do decide that maybe we want to ease up on some of these measures, what are there any plans, and what are they for the gradual reopening of our economy, to ask it in a
we will determine that when we get there. We will advise the Honorable Prime Minister, who will make the ultimate decision. But when we get to that bridge, we will cross it. But let us keep on the focus now and keep the pressure on to prevent community spread.
Do you all at least have a skeletal plan that you all would like to build off of at that point?
We have plans for all outcomes, but let's keep the pressure on.
Yes, Drew.
Drew, whoever could answer. I'm just wondering, one, in terms of the issue of deaths and any cross-referencing, let's say if someone has died of a respiratory situation, but cross-referencing just to make sure it was not COVID, outside of the deaths that have been confirmed by the ministry. Is that being addressed?
Yes, so we generally look at deaths. Whenever there's an epidemic of any sort, when we started with H1N1, we look at two things. We look at influxes of persons with respiratory symptoms coming into the facilities, and we look at an increase in deaths. So we have been looking at both, and we haven't seen any great increase in deaths for the time, based on what we see for the previous year's trends, related to respiratory illness as well. So we keep an eye on it. Testing aside, we look at deaths, and we look at the number of viral illness in general. And we have not seen a great influx in any of the two items. And basically, that is how we look at, outside of testing, that's how we do some form of surveillance to see what is going on.
In terms of, Minister, pharmacies or anywhere else that may be selling the masks and so on, they are also seeing this increase in pricing. You have said that as much as possible it should be dedicated to medical professionals, but what would you say to those, anyone that is selling and continuing to raise the price of those products?
Well, first of all, Joel, it depends on the type of masks. So a pharmacy should not be selling N95 masks. Those are for frontline care workers. We ask everyone to be responsible, but what I will tell you, and I'm happy to report that Field yesterday received their first tranche of masks to give out free to their client base. They got 10,000 masks yesterday. I was there for the handover. So that's a very positive development. And those 10,000 initially are absolutely free to members of the public. So they don't have to buy in any pharmacy.
Just one other follow-up, if you don't mind, Prime Minister. Also in terms of there may be staff, I'm not an expert in this, but staff who may not necessarily frontline medical personnel, but who may be involved in the health sector, dealing with patients in whatever way. How are you dealing in terms of their safety, apart from those who are on the front line?
Sure. So there's two departments. There's a health and safety department in every facility. Together with the chief of staff, they're determining, based on the healthcare workers plan, who are the people that require masks, and not only who are they, which types of masks they are being given. So that is guided by the policy related to healthcare workers. As we had said before, N95 is for a specific category of people that have do procedures, for instance, intubation and those and alike, and testing. So those will be reserved for those groups of people. Surgical masks are used for a wide group of people within the healthcare workers. So they are using surgical masks a lot. They're using some cone masks as well. So different categories for different levels of staff, but it's determined based on the policy at the institutions.
And let me just add, the RHAs, each of us sewing department, we have given them material to actually make their own masks, which is started, I believe, last week, for not frontline, for healthcare workers who are not on the front line. And I was in Port of Spain Hospital this morning, and almost a man, every single healthcare worker had on some type of mask, depending on their level of exposure.
Minister, just on one final question. Okay, so you said when we reach on April 30th, we would determine how we go forward, if we would reopen, if these measures would continue. So could you at least let me know what are some of the...
Let me just clarify that we didn't say that. Nobody said on April 30th we will do anything. What we have been doing is making adjustments along the way, well in advance of the deadlines we've been working with. So before April 30th, the issues that you're trying to raise will be raised by the government. You're a little early, but we are not unaware of the issues that you are raising. But we didn't say on April 30th we'll make a decision.
Okay, well, pardon my error, but would you at least be able to let us know what are some of the considerations which must be taken in mind when making this decision?
Well, obviously, you will look at your infection rates, your death rates, and all of those type of statistics will be some of the factors you may want to consider, but it is way too early in the game to even begin to talk about that. Today is only the 16th.
If I may follow up on Richard's question, has there been any sort of increase or decrease in the number of people who have been coming in to showing symptoms, for example? And I mean, I suppose that could be an indicator that social distancing could probably be working.
Well, over the last week or so, I've been getting anecdotal reports as well as other reports from the system, and they have actually shown somewhat of a decrease over the last week or two of persons presenting to the facilities.
And just quickly, Mr. Deyalsingh, the PCR machines, have they been certified by COUVA yet? Do we have like a timeline for that?
Yeah, so the Chief Medical Officer, we had that discussion this morning, and he will give you an up-to-date position on that.
So in terms of certification, we're looking at quality assurance. So I have teamed up with both PAHO and CAFA. Trinidad Public Health Lab, which is under the Ministry of Health, will take the lead on it. However, we are working together with PAHO, who has a quality assurance team, as well as CAFA for their technical oversight using their virology unit to do so. They have looked at a couple of our machines already, did a look at the specifications of the testing, as well as the machines, the location that we're going to put it, and they're happy so far with what we have chosen. But it's actually when you start to use the machine, then you can actually send tests for them to check to see if it's a false positive or true positive. So that will happen when we start to use them.
When do you think we can start using them?
I don't want to put a date to it as yet. We just want to make sure we have everything in place. Staff are trained, being trained as we speak. Make sure everything is in place first, and then we can give you a date a little later on.
If there are no, you have one more question, right?
Do you have any enough experts in these various fields within the public health sector to deal with this, or are you seeking consultation outside of the public health sector?
You're referring to testing?
In general.
Yeah. So, sure. So in the area of testing, we are currently training 50 people, I believe,
Yeah,
Dr.
roughly,
Parasram.
yeah.
We are currently training about 50 people across the RHAs to do just that. So we're going to have more than enough.
So basically, the medical lab techs that would have been doing it all along are the people that are going to do the PCR testing. PCR is nothing new for them, but whenever you have a new machine and a new test, there's some small modifications in terms of training that has to occur, which will be happening. But as I said, CAFA and PAHO is providing technical resource as well. Yeah.
Okay.
Yeah.
If that exhausts your questions with respect to
Thank you very much, PM. There are, in fact, two issues, if you don't mind, Prime Minister. The salary relief grant is going very smoothly, and I can report that the project administration unit that is handling the receipt and evaluation of applications for the salary review grant reported to me that this morning, as of this morning, they had received 4,161 hand delivered applications. These would have been applications for the grant that would have been placed in the drop boxes at the 15 TT Post locations, 13 in Trinidad and 2 in Tobago. So far, this number has been updated all the time, but this is the last figure I've received, 4,161 hand-delivered applications. Online, 34,000. So that we have, at this time, in the vicinity of 38,000 applications that are currently being evaluated. Not all of them, obviously. So they have to do them in batches. But as they come in, the team is evaluating them. I've had no complaints from police stations or from TT Post offices in terms of the collection of the forms at the police stations or the deposit of the forms at the TT Post outlets. And I want to stress that was an option made available to persons who may not be internet savvy. When we were designing this framework, after a lot of discussion, this was a team effort, as I said, and a lot of people involved in the discussion, the view was expressed that there will be some people who do not have access to the internet, who are not computer savvy, don't have access to scanning capability that they could email and that sort of thing, so that we would have to cater for those people who would physically want to collect a form rather than download it from the internet and physically drop off the form with the supporting documents. And that's why we have established the TT Post offices for drop-off and the police stations for collection. And from all reports, from everything I've received over the last several days, that went extremely smoothly with no confusion whatsoever. What I can say is that the ratio of online applications to physical hand-delivered applications is about 94 to 6%. So we have far more online applications than hand-delivered applications with respect to the salary review grant. The other thing I'd like to talk about, you'd have seen in the newspapers on Tuesday, it started off in The Guardian, an advertisement put out by NIBDEC on behalf of the government, and in fact that is on behalf of the Ministry of Finance. We felt that NIBDEC is already in the business of procuring pharmaceuticals for all the RHAs and other medical products for the RHAs. So we felt that they would be best placed to deal with this. And if you look in the ad, it was an advertisement for individuals, and this is very important, sole traders and firms or companies to submit offers for the local manufacture of cloth face masks. And these cloth face masks have to be made in accordance with the guidelines on the Center for Disease Control website, the CDC website. There are some very good guidelines there with respect to the manufacture of cloth masks. And we'll be asking people to, when they drop off the tenders, it's basically tenders, it's offers, these all have to be physical, at, again, at TT Post locations and at NIPDEX offices as well. They have to submit a sample, which we would get the Bureau of Standards and the UTT's Department of Fashion to look at for quality. That is going very well as well. So far, the information I have, I was a bit surprised that 20 entities in Tobago have already picked up the forms. This is physical. And 30 or 40 in Trinidad, and significantly more persons would have downloaded the application and tender documents online. Thank you very much.
If you have a question for the Minister of Finance on this or any other matter concerning his responsibility, now is the time to put that question to him. If there are no questions, then yes, Jude.
Minister, I'm just wondering, you had said when you had announced the salary relief grant, if I'm not mistaken, about 80,000 persons could be eligible. But this would have been announced, again, if I'm not mistaken, before the closure of the restaurants and so on. So does that 80,000 include those persons who are now not working in those restaurants, or are they additional to the 80,000?
Let me just correct something you said. I was very clear when I made the announcement in this room that this was in response to the first public health regulation on March the 19th, where bars, restaurants, etc. were closed. So that 80,000 was an estimate based on looking at the data from the Central Statistical Office, from the business organizations, from the Ministry of Trade. We asked them to do some research for us, and the 80,000 assumes that there are 60,000 persons working in the hospitality sector, let's call it as a generic name, hospitality and tourism entertainment sector. We added in another 20,000 for indirect workers in that sector. That's how we came up with the 80,000. So that 80,000 was targeted at persons directly affected by the first set of public health regulations.
No, the figure no would be what?
Obviously, as we go along, this is an evolving situation, and decisions are not cast in stone. As we see the applications come in, I may have to go to Cabinet or consult with the Prime Minister if that is, it is not necessary to do it at the level of the Cabinet, and see how many we can accommodate. We've set aside $400 million for this, which really is about 90,000 persons. And we may, in fact, be dealing with more, but as the numbers come in, we will deal with them. We're going to deal with every application in terms of the criteria that we have set out, that you must have lost your job because of the health and safety measures that have been taken by the government.
Just one other follow-up, if you don't mind. Initially, you had said that the salary relief grant should be for about a 3-month period, if I'm not mistaken.
It is for the months of April, May, and June at this point in time. As you have just posed some questions to the Minister of Health and the Prime Minister, which they said, you know, they will deal with in due course. And therefore, we are estimating at this point in time that we will have to provide relief for April, May, and June at this time.
To conclude the question, therefore, is it that the government had anticipated that they would be looking at a period past April for the closure of businesses and so on, and hence the length of time for the initial period of the salary relief grant, or was it just for some other factor?
We used all information available to us at the time, the committee that came up with this. We used all available information, locally and internationally, and consulting with all the experts and so on, to determine that we should cater for a 3-month period. Remember, we are catering for 3 months. What happens in June, I can't sit here, I don't have a crystal ball. I don't know what will happen in June. So we catered for April, May, June based on all of the available expert information and all of the advice we received from a wide cross-section of sectors and sources.
So just to clarify, do you have a timeline in terms of how long these applications will be processed and then payments finally coming out? And then just very quickly, I think that it was mentioned that self-employed people can now apply for these grants. The last time you had your press conference, you said you all were working out the criteria for that for phase 2. Can you just elaborate a little bit more about it?
Yes,
please?
let me just correct you. The Ministry of Social Development has invited people to apply for income support grants, and they have invited persons who are outside of the national insurance net. So the Ministry of Social Development has already launched an initiative to deal with persons in the first batch who would not be within our criteria of being registered with NIS and the employers registered with NIS and so on. As we go along, I've been in discussions with the Minister of Social Development, and of course this will be a policy decision at the level of the government and the Prime Minister. It is my proposal that we harmonize so that, you know, there's flow of information and cross-fertilization between the two units doing the evaluation and the distribution of the income support grants. But the income support grants are already out, and those are to deal with people outside of the NIS net. And you had a second question, could you just remind me? Yes. What the administration unit has told me, they estimate that within about approximately 2 weeks, they can start to issue the first set of grants, approximately 2 weeks.
Okay. Thank you very much. I want to pick up from where the last speakers signed off with respect to overall handling of the situation with respect to the virus. One of the issues that came up recently was the standard of care that was being offered to persons who were required to be quarantined under the government's control. I simply want to say that in Trinidad and Tobago, our default position is to take the line that it's bad. You don't normally find that we say, okay, most of it is good, and therefore, let's acknowledge that. As head of the government, this country is doing very well in providing accommodation for persons who find themselves, unfortunately, being designated citizens who require this close quartering. And as a result of that, we have been looking for accommodation that is of a good standard. I know that not everyone will agree that the accommodation that we provided is up to everybody's taste, because some people might have a different taste. But by and large, we have been doing that, and today I'm happy to report that as we continue to do that, we are able to provide, in the pool of rooms available, in the event that such rooms are required, the accommodation at the home of football. That building, you know, came into being as a result of a public-private arrangement between the government and FIFA. The government was approached by FIFA for public lands, and the government didn't make those lands available, and FIFA didn't make the funding available, and out of it came the building of the home of football, which is in effect a kind of hotel. And it has been offered to the government, and the government has accepted the offer. It has been evaluated and found to be excellent, and my advice is that it can accommodate up to about 72 persons of a category that will be designated by the Chief Medical Officer and the Minister. But this is as good as any accommodation that you can get anywhere in Trinidad and Tobago. So if that kind of accommodation is not found to be suitable, well, then you know that we've exhausted the limit to which we can go as a country. So within a week or so, that facility should be available. There are one or two things to be done. And I may also add that the private sector has been approached to put in some outfitting items, and the private sector has come forward and has committed to ensure that whatever is required to make it comfortable and fully utilized will be so. And I may also add that it is offered to the government of Trinidad and Tobago at no cost. And the private sector additions, whether they're items of appliances and so on, they're all at no cost. This is very good. It's because it allows us to manage this without too much of a burden on the taxpayer. And I'm happy that people are chipping in this way. And this is one government initiative that has come around. Having cast a national bird upon the water, it has come back to feed us on this day. So, ladies and gentlemen, that is there. And I want to make another comment, another area of interest, which is one of great anxiety to family households, and particularly parents and our children. We know, those of us who've had children pass through the SEA system and so on, we know the anxiety and the tension that exists with respect to these children's future. But we also know that what we are involved in here now is a once-in-a-lifetime arrangement, not of a good kind. We are living in the era of a pandemic where the objective is to try and survive it, saving lives. And all that we are doing, the number one priority in all our activity is to ensure that we come out of it alive and whole. Unfortunately, as you see in many other countries, some people do not come out of it alive. We want to come out of it alive, all of us. And that is what our effort is about. Having said that, the education of the children remain a priority, and you would have heard from the Minister of Education what little is being done or could be done under the current circumstance to ensure that there's some effort at maintaining some kind of educational effort. But also, as we get to the question of the terms, the parents should be made aware that as of now, we had restrictions, or we have restrictions in place up to April 30th. Because when I spoke the last time extending our restriction to the 30th from the 15th, I did indicate that it is not feasible then to think in terms of the schools being open anywhere inside the range of the 30th. And if we are going to be locked down in the way we are, stay home until the 30th, clearly that school activities would have to be beyond the 30th of April. Now, as we are here now in the middle of April, we are looking at the horizon as to when the school can open. And this is where we have to let our anxiety be tempered by the science and let the decisions be made by the science and by the public health experts who give us the best advice available. And that is the advice that the government takes. Because we have seen that if we, in our anxiety to bring an end to this as early as possible, much as we would like it so to be, we have to be very careful that we don't do anything that gives the virus the opportunity for a resurgence. I'm very pleased to hear today that the question that was asked is, what are we seeing? Are we seeing more people coming forward and presenting that they are infected? The answer is no, we're not seeing that. That does not mean that we are at the beginning of the end. We might be at the end of the beginning. But we also have to be very mindful, given what other people have experienced and what we don't know about the virus that we're fighting, that the fact that we've seen what the CMO mentioned is no guarantee that the period beyond the 30th is available to us. We have to go a little closer to the 30th, which is what the question that was being asked by the gentleman at the back. And we're saying to you, let us go a little closer to the 30th, then look and see what level of infection rate we have been carrying and the rate at which there is any acceleration or deceleration. And that is what is going to cause us to make another decision. You may recall when I first mentioned the closing of school, it was as soon as you realized that the withdrawal and the congregation was what we had to stop. We did close the schools for 1 week in the first instance. That phrase was used. Closed for 1 week in the first instance, expecting that it is quite likely that 1 week may not be enough. And surely enough, we had to go beyond the first 1 week, and then we go on where we are now, and we're down to the 30th. So I can tell you, well before the 30th, but not as early as now, we will evaluate the national profile, the national response, and the professional assessment of the state of the infection in the country. And that will determine what decision we make as to what new deadlines and dates we put beyond the 30th. And I expect that by the beginning or by the end of next week, we'll be able to assess April and look into May, June. Now, a question was asked about why cater for 3 months. I have a good idea what that question is all about, but the answer is, when we started out, what little was known about the virus and how it was being handled elsewhere, and what little the biologists were able to tell us as to how a virus profile would have operated, that clearly, within that 90-day period, we cannot expect to come into it and get out of it within 90 days. That was just a horizon of minimum, one could say a minimum. In fact, other experts who did the longer profile tells us worldwide that we could be responding to this virus for the next 18 months. And I did say so from this podium. 3 months was our horizon to provide relief. And we could be looking at managing issues, because if we don't get a heavy infection and we are able to continue some semblance of life living with the virus at some level, we have to be cognizant that we have to make that living maybe for another 18 months before it becomes either subject to a vaccine or would have sufficiently infected worldwide that it now becomes a fait accompli. So we catered for 3 months, using all the resources we could draw up, and we're hoping that by the end of 3 months, we should be in a position that was better than the beginning. But, as I said the last time, there's no country that has been exposed to this virus that has come out of it and declared what the minister calls victory. You would have seen what happened in Korea. South Korea was the gold standard for how well it could have been managed. The recent and last news we have out of South Korea is that 150 persons who had been cleared as negative, having passed through the infection, have now again tested positive. That is frightening, because it means that what we call in Trinidad attack back. Attack back could take place. So you don't begin to behave as though all is well because you've passed a certain hurdle. You also saw there's another country that did not take the hard decisions and drink the bitter medicine at the beginning and walked along the lines that, well, we aren't very infected and therefore we could sidestep the issue. When the virus did manifest itself, having not been restrained by the methods that others were using, that country had to go straight to a state of emergency in a variety of cities, because the biology of the virus is the biology of the virus. Not every country is doing what every other country is doing. Decisions are being made based on the circumstance in that country against the background of the biology of the virus. So if you look at the Caribbean, you see all of us following certain lines, but with little variations here and there, whether it is a state of emergency, a curfew, a stay at home, a total lockdown for a week, banks closed in one country but didn't close in the other. So you'll see those nuances. There is no switch that you have to put your finger on and take it off and take it on. What you have to do is what we have done in Trinidad and Tobago, and that is be guided by the science. And this is where I want to say a little bit to the population of Trinidad and Tobago. We know that there are implications, and we know that the government's actions would be questioned. But we have taken the position that in our little country, in these our little islands, it is possible for a government to speak to this population and get the population by the majority, large majority, to see the rectitude of our cause in public interest and the common sense of what we are doing for the public. That's how we approached it. So the demand for a state of emergency and all of that, we hear that. But what does a state of emergency bring? to this fight. It brings additional powers for the police. It brings reduction in your rights and privileges under the Constitution. That's all, nothing else. Because what you will have to do to respond to the virus will not change. It will not change. So you might as well get on with what you have to do. Whether there's a state of emergency or not, you get on with spatial distancing, personal hygiene, and cooperate in absence of congregation, and most importantly, be our brother's keepers. That's what he has to do. And of course, your government is not without some experience in this matter. And let me tell you why. In the Caribbean, we experience hurricanes every season, to the extent where we have hurricane preparation long before. And we all know what's going to happen in a hurricane. And it's also going to last for a few hours at most, and we know the kind of damage we can expect. We also know the end game after the hurricane. You get some damage and the wind has gone, that's the end of it. From a hurricane standpoint, you go into reconstruction after that. The difference with this virus is that we don't have the preparation. Is novel corona, new virus, so there was no preparation. 2, we have no antidote, no vaccine. And 3, we don't know how long it will last. The only thing we know for sure is that it kills people. That much we know. And therefore, the government's reposing its confidence in the population and fighting it on the basis of the science is what the Caribbean has always done. This is not the first natural disaster that we face. A hurricane is a natural disaster. An earthquake is a natural disaster. COVID-19 is a natural disaster. It's biological, but it's a natural hazard and natural disaster. How has the Caribbean dealt with natural disasters before? Before the science was available, a natural disaster took place, 2 natural disasters took place in the Caribbean, in my field of expertise. 1902, in the city of Sangre in Martinique, the volcano at Mount Pelée was rumbling. And because there was no science available at the time to tell the Martinicans what that rumbling meant and how dangerous it was, in the absence of the science, they stayed there waiting for an election that was to take place. The volcano erupted just before the election was due, a few hours before, maybe the day before, I think it was. Sangre had 29,002 people by the census. 29,000 people were killed in that city. Only 2 persons survived. One who was in a dungeon as a prisoner, another one who was in a dungeon as a madman. They were the only 2 people who survived the destruction of Sangre. That could never happen today, because the minute the volcano begins to warm up, far less to rumble, there are scientists on that volcano that will tell the population it is time to withdraw, because withdrawal from that area is the only response. But in 1902, that wasn't available. Within a matter of days, a similar eruption took place in St. Vincent, at Soufrière St. Vincent, 1902. There was a sugar factory producing sugar under a rumbling volcano. Again, they didn't know what the rumblings meant and what the emission of steam meant. They stayed there. The volcano erupted and killed almost 2,000 people and put an end to sugar production in St. Vincent. But by the time we got to the eruption in St. Vincent in 1978, same volcano, many more people on the flank. The science was there, available to the government. I had the experience of working with the government of St. Vincent, responding to the natural hazard of the Soufrière volcano, where the decision had to be made by the government to evacuate the top third of St. Vincent. Everybody who lived in the top third of St. Vincent had to get up, leave your home, pack up, and leave, because it's the only response you make to this natural hazard. So the town of Georgetown, Orange Hill, Ovia, Fancy, Chateaubelair, all those areas was emptied. because they were in the line of damage. And fortunately, we can tell you, the evacuation took place by the politicians listening to the scientists, giving them the respect that they are due because they were the ones who knew what we were dealing with. And the political decisions were made on that basis in civil defense, and we didn't lose a single life in St. Vincent. Come Montserrat, a few years later, the city of Plymouth was completely destroyed. Not a life was lost then in Plymouth because the evacuation took place before. Telling our population, evacuate the capital city, get out. Montserrat had 13,000 people on the island. 10,000 people left in the face of that volcano. Unfortunately, there were some people who resisted in one way or the other, found themselves in the danger zone, and we lost about 17 lives. Not because we didn't know what was going to happen, but because some people decided, I will take a chance today. And on that was the day the volcano erupted. But that is the kind of decision that governments have to make in civil defense. And not every time you have to evacuate. Because in the case of Soufriere, Guadeloupe, that showed signs of eruptions, the town of St. Claude was available on the flank of the volcano. The question is, do we evacuate or don't we? But listening to the science and the advice from the scientists, the government, the prefecture in Martinique did not evacuate, and nothing happened because the scientists were able to guide the politicians to make a decision, wait for more information. The information we have indicate that we may not have to evacuate at this point in time. The politicians made the decisions based on the advice of the scientists. That is what is happening today in Trinidad and Tobago with respect to this natural biological hazard. The government of Trinidad and Tobago, taking the advice of the scientists and the public health experts who have been trained for this, and making the political decisions as to what we do and what we don't do. And therefore, when others come to you to tell you that the government is hiding information and that it have more people in the country who are dead, remember they are the same people who, before we had a single confirmation of COUVA in this country, were putting out on Facebook that a Chinese ship was in Point Lisas and they were taking up dead people by the truckloads. All of that was part of that. It was the same people who, when there was a flooding in Greenvale, dangerous flooding, people almost died, but no one died. The Coast Guard was there doing yeoman service. People came to the rescue of their neighbors. We didn't lose a single life. They were the same people who put out across the country that so many persons had drowned, and the Coast Guard was instructed by the government to hide it from the population, that people had lost their lives in Greenvale. Same people. They are the same people today who are telling you that what the government is telling you is not true because the government is hiding. This is a slur, and it is a disrespect of our professional people who are doing a job as good as anyone anywhere in the world on this matter for the people of their country. And once again, I want to thank, on behalf of everybody in Trinidad and Tobago, every citizen, I want to thank the healthcare professionals and all our people who are involved, putting their lives on the line. In case you all don't know, putting their lives on the line. Go look on the television and see how many doctors, how many paramedics, how many nurses have lost their lives in this fight in other countries. So because we haven't that report to make of such a disaster in our country, it gives no one the right to cast aspersion on the professional conduct of our professional people who we have relied upon to make these decisions along the way. Heading the political directorate, I want to give the country the assurance that we will make political decisions. Not all of it will meet with the approval of everybody in the country. But rest assured, it will not be vai-qui-vai. It will be decisions made for Trinidad and Tobago in the best way for the singular purpose of protecting the people of Trinidad and Tobago based on the scientific advice that we glean from the rest of the national partnership, which is the professional group, and those on the front line, those on the front line. And because we have been fortunate so far to receive the kinds of report that we're receiving, does not mean that we have gotten away I don't want anybody in this country to believe that because we are in a relatively good position now at this stage that we have gotten away, we have to hold the line. And that is why, once again, I want to condemn those persons who stick break in their ears. People lining up in front of a bank or sitting waiting to be asked, you don't have to sit down on your neighbor's shoulder. Talk to a person 6 feet away from you, they will hear you. I'm seeing lines still where people, you're in the line if you're on number 10, whether you're on number 10, 20 feet away or 40 feet away, you're number 10 in line. Give space, because the breath that you might inhale might be somebody's foul breath carrying the virus. What more can we tell you? And for those who have to go to parties, I hope that the police has a party meter to find a party wherever it is, and the government doesn't give instructions or advice to the police, but as a citizen, I hope every party ends up with a full Black Maria off to the local jail and let them go and raise bail there, because what they are doing are being hardened, destructive, uncooperative, because that party could be the place where a number of persons can get infected. And then what do they do after they're infected? They turn to the state machinery for health care, for accommodation, and of course for you, the media, to say the Prime Minister didn't do it, and the Minister didn't do it, and the CMO didn't do it, when in fact what happened is that they could not do the simple thing of being careful and being cooperative. This is a fight that we are fighting at the individual level, and I must say that every time. You are a soldier in this fight. You fight it where you stand, where you sit, where you walk, where you go, what you do. So far, we are fortunate not to be able to report to you that there are hotspots where we're seeing people coming into the health care system presenting symptoms of ailment. But there are those who are trying to tell you that something is being hidden. What? What's being hidden? What is being hidden are some people who think they can hide by not helping us to cooperate. We, from the beginning, have said to the country that we will share with you everything we know. We told you up front that there's a lot that we don't know, not the least of which we don't know how this virus is supposed to behave. That has not changed. That has not changed. But what we do know is that there are some things that we can do to give ourselves the best chance. And that is what we have been doing. When I reported to the Parliament a little while ago, I said that we would do an immediate analysis of our circumstances right now, and then we'll bring together expertise to do a longer horizon assessment. We did, under Professor Carl Theodore and a team of people that the Minister of Finance put together, we did look at our immediate situation to see what the outcome is likely to be. For example, what damage is being done to us and our economy by these actions that we have to take and so on. And we got a first draft presentation from that team under Professor Carl Theodore from UWI, and the Minister of Finance has sent them back to refine that, because as we go forward, we are having, in that equation, in the econometrics, we have to also look at what is happening as a result of what we have been accomplishing or what we are exposed to going forward. In a week's time or thereabout, that exercise would be, have been fine-tuned and come back to the Minister of Finance and to the Cabinet. Today, I want to report that we are going to the next phase, to prepare for the next phase. And that next phase has to do with a roadmap to recovery. We have to anticipate, as we expect, that all of us will be here when we come to a point saying that the worst is behind us. I couldn't tell you today, in answer to the question that was raised by your colleague, as to when we will begin to come out of this situation. We have to determine what level of risk we are prepared to take. In some countries, as a matter of fact, I think it's Denmark this morning or yesterday announced that they're going to send their kindergarten children out to school. The main reason for sending that cohort of population out to school is that so far the virus has shown that those very young people are maybe they're better able to handle the exposure. And, you know, they compare that who's presenting and who's dying from it. Very young people seem not to be in that. Not that they have not been exposed, but the population of very young people seem to be the strongest in dealing with the virus. So one government, which was one of the early governments to have taken the steps of shutting and shut down, they begin to come out by exposing that population to school arrangements. Some other countries, some other governments can't do that because their circumstances are quite different. We in Trinidad and Tobago, we will make our own analysis. And then, having analyzed the situation, we will determine how we come out of this. As leader of this team, as leader of this fight, I'm saying to you, we want to come out of it as quickly as possible. But not so quickly to be premature and to expose ourselves to a resurgence which, had we not done that coming out, we could have survived a bit better. But it's a call that the government will have to make. And we intend to make those calls based on what we are seeing and assessing as the nature of our population. The level of infection, the rate of infection, the cause of infection, and whether we can manage to live with the virus in such a way that we do not worsen our condition. So we'll come to you with that in the coming days. I know there's anxiety for definitive arrangements, but one of my colleagues this morning at Cabinet spoke about the need for certainty. And even though he was a little anxious for that certainty, I had to say, and I'm saying to you now, that certainty that we are after is not available. In treating with this virus at this time, that certainty which will make the parents of the children for the exam be more comfortable, to make the captains of industry to know that, well, you can restart your plant next month or next week. That certainty is not there. But an expectation is there. Because if, having managed it the way we have managed it, if we are fortunate to continue on this trajectory, there's an expectation that sometime in the not too distant future, and to use a phrase from the economists, all things being equal. Of course, they never all being equal. If things remain such that our level of risk could cause us to use the scientific advice that we have and to not overexpose the population, we will begin to come out of this. What day, what week, I cannot tell you at this time. I'm just telling you what the intention is and the expectation. Hopefully, as we pray, as we act, we expect that we too can have a good result. And if we get a good result, we will come out of this in a period of Thanksgiving. So the team that we've put together to prepare a roadmap to recovery reminds me of my own home. After Hurricane Flora in Tobago, the entire village of Mason Hall, barring a handful of houses I can count on one hand, survived. And we were living on cots in tents put up by the Defense Force on the recreation ground. And after a few days of this, we decided to go back to our home and pick up the pieces of what was left of the house we lived in. Pieces of board, galvanized sheets. We picked up enough pieces to build a one-room house. And we entered that in great triumph, because a one-room house of your own was a great advance on a cot and sharing a communal latrine with the rest of the village. So we don't know what this virus is going to leave us with. What we do know is that we have a resilient population in a part of the world that is as attractive and desirable as any other. And the assignment will be for those of us in these islands to decide to pick up the pieces, whatever they might be, face our challenges, build a new pathway, and begin to rebuild our lives post-COVID-19. So, as Prime Minister, I will chair this group. The group will contain 2 other government ministers, Minister Robert Lee Hunt, very experienced person. He will be the vice chair alongside a co-chair, Mr. Jerry Brooks. And it will also include to do some accountant, secretarial work for the groups, Minister Alison West in the Ministry of Finance, who would come to the government from the private sector. It will include Mr. Wendell Motley, economist and former Minister of Finance, Mr. Robert Bermudez, one of our frontline businessmen who chairs the board of one of our largest conglomerates, Ms. Karen Darbesi for banking, Mr. Winston Dukaran, economist and former Minister of Finance and central banker, Mr. Christian Mute, a businessman, largely in retail and services, Mr. Colin Supinchow, expert in accounts and finance, Mr. Sean Roach, a medium-sized businessman in the manufacturing sector, Mr. Ronnie Mohammed, businessman in his private business and chairman of Caribbean Airlines in public business, in the food production business, Mr. Vincent Pereira, a businessman in the energy sector and chairman of the country's largest bank, Mr. Vishnu Dan Paul, our most experienced permanent secretary in the Ministry of Finance, Ms. Alison Lewis, a former PS in the Ministry of Finance, very experienced in public business and public financing, Mr. Gregory Maguire, an economist from UWI, Professor Carl Theodore, economist and specialist in health economics, who heads a team of younger experts in this same field, Dr. Selwyn Hazel, an economist from Tobago, Mr. Christopher Henry, a labor representative from JTOM, Mr. Michael Anisette, representing Natuk, labor, Mr. Alan Warner, a businessman, experienced businessman from Tobago, and Mr. Rondell Fields, representing the public interest. All those persons will come together to work alongside other aspects of the government effort. But their assignment, as they break themselves out into smaller specialist groups and working together under the chairmanship and guidance of the Prime Minister, who will receive their recommendations and work with them in crafting those recommendations. And we will pick up from them in the end a roadmap for Trinidad and Tobago post-COUVA. When that assignment should be completed, I would say I'm hoping that by the end of this month, we should have a rough draft, and we work into the month of May. And if we are saying that we would not be out of this danger zone until, say, May, June, I would give ourselves until the end of May to draft this roadmap, its architectural shape, its engineering structure, and its hope for the people of Trinidad and Tobago. We should have a document by the end of May, having consulted widely other persons whose names have not been called here, but this group will be free to co-opt and consult with persons who have something to contribute. And when we finish that, we would confidently step into the post-COUVA future. If you have any questions, I'll take them now.
Prime Minister, in terms of the roadmap, any sense in terms of how that will look in terms of, say, issues of diversification? Will you continue to be looking at strong reliance on the energy sector, things like that?
It certainly will depend on what we have been left with after the threat has subsided. So until we have a better idea as to what damage it has done to us, we won't have all the tools, all the components of the equation. But one thing we do know, that for better or for worse, this development has provided us with an opportunity to do some things that we probably would have had difficulty doing before. But now, it would be irresponsible not to do those things having been put in this situation. What those things are, I will not answer that now. Except that the opportunity exists for this kind of approach, this kind of arrangement, to put the country on a footing where we should be confident is the best footing given what the virus has left us with.
Prime Minister, will this document, as well as the one prepared by Professor Theodore for the Ministry of Finance, will they be made public?
At the appropriate time, yes.
This one, Prime Minister, normally outside of the pandemic situation we're in now, we would have had a mid-year review of the budget and that kind of thing. How is the government managing the issue of budgetary management of not just this, but the overall government expenditure at this time?
What I did say early on, given what had descended upon us as the turn of 2020, we having put a budget in place where the first quarter would have been concluded December 31st, that given what was required of us to respond immediately, we literally had to not be overly stymied by the budgetary provisions. Because you must remember, a budget is an estimate of expenditure against a background of an estimate of revenues. All of those two things, revenues and expenditure, went out the window when this virus hit us. What we had to do is to look for a pool of resources in and out of the budget to respond to the virus. So basically, the mid-year review that normally would have taken place is not what we are involved in now. And this may be a year where we may not, in fact, do the normal mid-year review. We could report perfunctorily because it's a changing canvas, day by day. Because one of the things we've had to do is to increase government expenditure to bring comfort to those people who are least able to look after themselves. Because if we had not done that and managed the situation based on what the budget was saying, that you wait to receive these revenues to be able to respond to these people, then the hardship and the pain would have been multiplied manyfold. And having said that, it is obvious that you understand that the government would have borrowed money. And whatever borrowing we do now is against the background of our understanding that we have a future, and that future will allow us to service those debts, but we come out of it alive. So that is the shape of things. And we are going to prepare. We will not be caught flat-footed as we work our way through life with the virus to the point where it becomes life after the virus. And even with the virus being with us, depending on the level of infestation, the level of infection, the heavy hand of death, so far we've lost 8 lives. We would have to walk alongside these realities as we continue to plant food, keep some factories open, keep some businesses open, look to our external markets. We have our people on the platforms producing hydrocarbons. The market for hydrocarbons is horrible at the moment, but we expect some improvement in that. The international market has a way of rectifying itself because there are so many losers waiting in the wings that they eventually get together and become winners. So we have to just be patient, but not be sluggards. You know, we just have to prepare ourselves, accept the reality that we could not change what we can change for the better, and work along a pathway of a plan. And that plan is going to come. Yes.
Prime Minister, you mentioned borrowing. Can you just clarify, is that just the international organizations that I believe Minister of Finance did mention, or is it also, have we, started borrowing on the private sector?
We have said that we looked for resources everywhere. Once we were facing this problem, very early, you may recall, one of the first ministers presented to you by the government was the Minister of Finance. And we told you we would look everywhere where resources can be had, because this is calling for and is eating up significant resources, and it is making the demands for those resources now.
Have we received any of the money that we've applied for it, and have we put it into the system? I'm not sure.
Maybe the Minister of Finance can give you a thumbnail sketch.
From the Andean Development Bank. You heard me now? Right. From the Andean Development Bank, which is known by the acronym CAF, we already have CAF. No, CAF. We have already received approval from the Board of Governors for a loan of $200 million for air and sea transportation infrastructure and air and sea transport generally. We have also received approval from the Board of Governors. You may have seen an advertisement that CAF put out either yesterday or today. They have also just approved $50 million US in emergency funding to deal with the COVID problem for Trinidad and Tobago. We also got approval, cabinet approval today, for another part of the Global Economic Relief Plan from the Andean Development Bank for a further $100 million US from CAF. Now, these are fast dispersing loans. The loans are available to us very, very quickly. CAF has a very quick turnaround. This money can be available in a matter of 1 or 2 weeks. So we draw down on the funds as and when we require them. With respect to other local borrowings, we have been in the local market now for the last several months, and we are borrowing locally. One of the points the Prime Minister made is that we have to spread it around, but I want to make the point, even though we're in a very strange situation, we still have to look at our economic metrics, our credit ratings and so on. And you always want to limit as much of your foreign borrowing as you can, because the agencies look at your foreign debt to GDP ratio. Our ratio is currently very good, but we need to look at spreading it around. And when you borrow in TT dollars, it's a much easier situation to manage than when you borrow in US dollars.
If we've actually, the money that we've requested and accessed, if the money that we've requested, if it's been put in the system yet, have we been using, say, that CAF fund yet to... The
$350 million US is available from CAF as soon as we ask for it. All of the documentation has been done. As I said, we have been borrowing on the local market, and we are managing our situation quite well. I can't give you a figure right now.
Of the terms of these loans...
on the local market?
Yeah, what's like the interest rate?
We use the central bank yield curve as a guide. The central bank publishes a yield curve on its website for 1-year borrowing, 5-year, 10-year, 15-year, 20-year. We use that, but the market is a bit unusual at this point in time, so that we simply use the yield curve as a guide in coming to our decisions.
And just very quickly, Minister, I know the IMF spring meetings are going on right now. Can you give us like a kind of local perspective on, Trinidad's contribution? I know the central bank did make a presentation.
Well, if the Prime Minister will allow me, I know he wanted a snapshot, but I can talk about an IMF video meeting. Each country of the IMF, is 170 of them or more, is represented on the Board of Governors of the IMF by someone. In most cases, it will be the Minister of Finance. So I was invited as one of the members of the Board of Governors of the IMF to participate in a meeting, video meeting, using a forum called WebEx, by the way, which I was able to see about 50 people on the screen at one time. It was quite interesting. And this was launched out of the headquarters of the IMF in Washington. And we had a very wide-ranging discussion. We had presentations from various experts around the world, and then various presidents and prime ministers, ministers of finance came in. Actually, the Prime Minister of Barbados was a feature speaker. The Prime Minister of St. Lucia spoke, along with other prime ministers from Latin American countries and other parts of the world and so on. The IMF is trying its best to adjust its normal procedures to deal with this pandemic. You see, the IMF is set up in a particular way. It is the lender of last resort. So that when you go to the IMF, normally they will ask you to initiate austerity programs, reduce subsidies and transfers, cut your expenditure, that sort of thing. There's also a group of countries called the IDA countries, which are the poorest countries in the world with a very low per capita GDP, and the IMF is focusing on those countries at this point in time. One of the things that came up in the discussion, coming from the Prime Minister of Barbados, speaking on behalf of CARICOM, and also the Prime Minister of St. Lucia, speaking on behalf of St. Lucia, is that they want the IMF to adjust its systems, priorities, and procedures to allow fast disbursement to economies that are in trouble. And the general mood of the meeting of the Board of Governors was very receptive. But these organizations take a little while before they come to a decision. It's not instant coffee. And while I'm at it, there is a bit of fake news on the internet that the IMF at its spring meeting yesterday agreed to wipe off the debt of 111 countries in the world. It's actually out there, the IMF logo. And we had to check with the IMF to make sure it's not true. What the IMF is dealing with right now is the 25 poorest countries in the world, and they are assisting them immediately with debt relief, and they're looking to see how they could send funds to other countries like Caribbean countries, but they will have to go through their procedures.
As you had mentioned the issue of schools earlier, I'm wondering, did you have a discussion with the Education Minister about private schools, those not funded by the state, in terms of the parents who may be asked to pay for terms when there is no school during those periods with the pandemic, and in terms of those teachers as well?
No, I have not had that discussion about that granular detail on what the private schools might do to the participants. But certainly we've had a discussion on the cabinet this morning, received from the minister an update by way of cabinet note on 2 windows with respect to the possibility of getting the exams done against a background that the school terms may be adjusted, as he did say yesterday. The first window is one in May, June, which is predicated on an outcome which is so good that we could have that exam at that time. If things are not that good and we would not be responsible to use that window, the other window is a September window. And he did indicate yesterday that the third term of the year of 2021 could be the casualty of trying to deal with what is happening in this disruption of the term in 2020. Because if we lose all this time from April into the summer vacation into September and beyond, because of the nature of the infection in the country, then we look over that horizon to a year that starts in January. And to prepare for that, you would need an exam sometime like about September. And that is as much as we can tell the parents now. That is as certain as we could be. The level of certainty, we can't go beyond that without pretending that we know how this thing is going to end and when it's going to end. And this government is not prepared to make that pretense to you. You see, if you don't have the responsibility to make the decision for people's lives, then you could say all kinds of things. You could promise all kinds of things. You could make all kinds of analyses. But the government of Trinidad and Tobago at this time has the responsibility to make decisions for people's lives. And we're not going to say to you that we know how this thing is going to end when we don't know. What we say to you is that we are walking this path on this journey. It's a dangerous journey, full of pitfalls, and we are hoping to avoid those pitfalls along the way. And how do we do that? By following good scientific advice from our staff, from our professionals, and from the people of whom we are immensely proud. And we must continue on a daily and nightly basis to be thankful that we have invested in the human capital of the people who are on the front line for us, from ambulance driver to police to soldier. They're all today proving that government does matter.
Another issue apart from the 33 nationals in Barbados, and we've heard the update from the National Security Minister on that, other persons are now saying that they are seeking some sort of assistance from the government in getting home. The government has made it clear its policy of not sending any flights out, but any sort of review, or are you discussing this with other governments? Or?
We have done, we've done that. For example, with the students that we had outside, I did speak about the possibility of us doing a milk run to get the students out of Jamaica, Barbados, get other people's children out. Turns out, going through the principals in the campus and the students themselves, turned out that even though that might have been a good thing to do, and the government would have undertaken to do that, when I talked to my colleagues in the Caribbean, the students themselves, most of them were not inclined to want to leave, because they were feeling that if they left, it would have been conceding their academic year. Some were close to exams and didn't think that, well, maybe if I hold on a bit longer. So in the end, it didn't come to pass that that milk run was what was desirable. So we went from there to a shelter in place. And that is what's going on, and I'm not hearing that there's too much hardship, and that's what we're monitoring. With respect to people coming into Trinidad and Tobago, let me make it very clear again. It is not all of us who have the responsibility to do the same thing. The responsibility to protect the 1.4 million people in Trinidad and Tobago is the responsibility of the government of Trinidad and Tobago. We do have a responsibility beyond that 1.4 million to another 300,000 outside of our country. But in seeking to make practical, logistical preparations and protection for the 1.4 million home, we went step by step, till we got to the point where we had to close the door. Many of our nationals are outside of the door, hopefully being able to cope, sheltering in place. If the door is not closed, the scientific information that we have available to us is that the best laid plans could become unlaid. I know what I'm being asked to do. I understand the pain of the separation, of not being home. I know. When I spent my first year on campus in Jamaica, the first Christmas I was not home with my family in Tobago, I make sure I lock my door. And I cry for the whole day. I know that feeling. I know the feeling of watching the television and seeing those coffins in New York being covered temporarily because they can't cope with the death rate in decent funerals. I know my daughter is there. I feel that every morning, every night. I've been to a funeral for 5 people to see my favorite brother go. I know that. So when there are people in this country looking for office, which is their right, and trying to tell you that the government doesn't care and the government is hiding information, I take that as par for the course of those who are on the wrong course. Thank you very much, and see you again sometime soon.
And that's a wrap on today's post-cabinet media briefing from the Diplomatic Center. Remember, you can join us for live coverage on TTT, Chalk City 91.1 FM, Sweet 100 FM, Next 99.1 FM, as well as on Facebook at TTT Live Online for all your COVID